Hello, this is Dr. David Green, Education Director for Premier Pain Specialists in Chicago. Today's topic is what are the available knee injections for arthritis treatments? Over 40 million Americans suffer from arthritis. It's the leading cause of disability in the United States. Interestingly enough, more women than men suffer from arthritis by 20%. The total cost for arthritis treatment exceeds $100 billion a year. Between 2000 and 2010, the number of knee replacements in the U.S. doubled. I can tell you right now that the population of the U.S. did not double in that decade. About 600,000 knee replacements are performed each year. By 2030, that demand could go up exponentially to 3.5 million a year. And 35% of those who receive a knee replacement are between the ages of 50 and 69. Knee replacement is an elective procedure. It should only be performed after considerable conservative treatment has been tried. Non-steroidal anti-inflammatories and Tylenol should be the beginning point. And there's also some prescription pain medications, topical pain creams, physical therapy, bracing. Now, when it comes to knee injections, there are several different ones we're going to talk about. Cortisone, hyaluronic acid, and then regenerative medicine injections such as PRP, BMAC, bone marrow aspirate, fat-derived, and amniotic-derived. Cortisone injections have been used since the 1950s. They've been a mainstay and are the gold standard for arthritis treatment. Initially, they were performed for rheumatoid arthritis, and then a few decades later, it spanned over into osteoarthritis. They don't cure anything. They just, and it's questionable if they harm cartilage. Now, there have been studies looking at whether or not they harm cartilage. They only have shown that in small animals. In large animals, nothing. In humans so far, nothing. Studies have shown that 75% of patients receive good to excellent results with cortisone injections for knee pain, which can last anywhere from weeks to months at a time. Hyaluronic acid injections are being used heavily today. Hyaluronic acid is the motor oil that's normally found in the synovial fluid of our joints. In 1997, the FDA approved the first HA preparation. It's made from rooster combs called viscosupplementation. Now there's numerous trade names available: Hyalgan, Synvisc, Orthovisc. Neither product has shown superiority. One of the largest studies in the U.S. showed beneficial effects in 80% of patients for over 6 months. That's why they're reimbursed by insurance when they get used. And the theory is that it provides lubrication, it is anti-inflammatory, and it can compel more cartilage to form. Now, PRP therapy involves a simple blood draw. The blood is then placed into a centrifuge, spun around rapidly for 10 to 15 minutes, which concentrates the platelets and growth factors. 1 to 3 injections are performed into the painful knee. And there are several studies now showing significant pain relief. The largest one was out of hospital for special surgery, which showed 70% good to excellent results at 6 months. That was with only 1 injection. And then preservation of cartilage in over 70% at 1 year's time. They did serial MRIs on those patients. Now, PRP therapy is similar to stem cell injections in a sense that they both fall into the regenerative medicine realm, meaning that they have the potential to alter the course of arthritis and not just to mask pain like a steroid injection. Now, PRP therapy doesn't have a lot of stem cells in it, but it can call in the body's stem cells when it's placed in the knee. Stem cell injections themselves come in several varieties. There's the bone marrow-derived stem cell injections, there's the fat-derived stem cell injections, and then there's amniotic-derived stem cell injections. None of these involved embryonic stem cells. They're all mesenchymal stem cells, and none of them involve fetal tissue. Now, multiple studies have looked at stem cell injections for knee issues such as knee cartilage defects. One study showed 6 months after transplantation, the patient's clinical symptoms had improved, and that was maintained over follow-up over 2.5 years. There are no large clinical studies in humans to prove the effectiveness, but there are plenty of small studies. The bottom line is that there are various types of knee injections available to help you avoid surgery and to achieve pain relief. All these are low risk and outpatient. In combination with other treatments available, they can help delay or avoid the need for a joint replacement, and all can be repeated every 3 to 6 months as needed. The top non-operative pain management in the Chicago area is with Premier Pain Specialists. There are several clinics throughout the metropolitan region accepting over 50 insurances and providing over 25 treatment options. Success rates are very high with the board-certified, award-winning, and fellowship-trained doctors. Call us today at 847-519-4701. I'm Dr. David Green with Premier Pain Specialist. Thank you very much for watching today.